Hello, and thank you for viewing my presentation. My name is Ariela Mervis, and today I'll be talking about patient perceptions of artificial intelligence, or AI, in dentistry. So we know that AI is making its way into healthcare, but when it comes to dentistry, there's still a lot of uncertainty. So AI has the potential to improve diagnostics, assist with treatment planning, and streamline administrative processes, but not all dentists are on board with its adoption. Dentists are hesitant due to concerns about cost, training, ethical issues, and regulatory compliance. And patients may also not fully understand how AI is being used in their care. My research focuses on understanding patient attitudes, including what they trust, what concerns them, and also what it would take for them to feel comfortable with AI being used in their dentist's office. To explore this, I took a qualitative study approach and designed a survey with open-ended questions that let patients share their thoughts in their own words. After distributing the initial survey, I revisited it and updated the questions by rewording them, including more specific examples, and also including a reference in the introduction for patients to view at their own discretion. The data was then collected through an online survey and manually analyzed using atlas.ti. Even though AI-assisted coding was available through Atlas, I chose to code the data myself to gain a deeper understanding of the emerging themes. Three major findings stood out. So first, trust and transparency are critical. Patients want AI to assist and not replace their dentist. And they need to have clear communication about how AI is being used in their treatment as well. Second, while AI is acknowledged as efficient for administrative tasks, some patients worry it might reduce personal interactions, which would make customer service feel more robotic. And third, AI in treatment planning is only acceptable under certain conditions. So patients want a human dentist to review and validate any AI-generated recommendations. In other words, AI can be a tool, but it shouldn't be making decisions on its own without human oversight. So when I revised the survey, I noticed engagement increased significantly, and no one responded with "I don't know" as they did in the first survey. This suggests that the updated survey format helped participants feel more confident in sharing their thoughts. Another observation was that AI familiarity no longer predicted skepticism. In the first survey, those who were only somewhat familiar with AI were the most hesitant, but this time around, responses were mixed across all participants, and I did not notice that correlation. Also, more people brought up more specific concerns. For example, HIPAA compliance was brought up for data privacy, and this wasn't as prominent in the first survey. So this revision gave me more thoughtful data to analyze. Overall, patients are open to AI in dentistry, but their acceptance is highly conditional. They trust AI when there's transparency and human oversight by their dentist, but they don't want the experience to feel impersonal. So AI is seen as beneficial for efficiency, but only if it enhances rather than replaces human interactions. For AI to be successfully adopted in dentistry, dentists would need to clearly communicate how it's being used and ensure that patients still feel personally cared for. A good change management framework would be ideal for this. So moving forward, research should focus on the best practices for balancing AI-driven efficiency with the human contributions that make healthcare feel more personal. These are my references, and thank you so much for viewing my presentation.